It's really lovely to speak to you today. I just wondered if you would just start by sort of introducing yourself and talking a little bit about your work as a psychotherapist, and what you do, who you do it for, and why you enjoy it so much.
Thank you. Hi, I'm Vivian Hart. I'm a psychotherapist. I've been working as a psychotherapist for about 30 years, both in the National Health Service and private practice, though more recently I've retired from my sort of permanent position, if you like, from the NHS and just do consultancy work for them now. I predominantly work as what they call a psychodynamic psychotherapist and group analyst. And I'm also trained in compassionate mind therapy for post-traumatic stress, and also interpersonal therapy, or IPT as it's called. And that's specifically for working with people with depression. My main work, though, is in individual and group work, which is about exploring people's difficulties that they present with now, and how those may relate to experiences that have happened to them in the past, and how they may repeat those experiences in relationships now. So both in individual and group work, I may help somebody try and make sense of that by unpicking what the difficulties are and getting a sense within the relationship between me and the patient, really, the client that I see.
Okay. Could you talk a little bit more about the group therapy that you do? Because that's quite an interesting type of therapy. And I would imagine a lot of people would have quite a lot of questions to ask about how it works, what happens when you join a group, how long you're in a group for, how many people are in the group, how it works with confidentiality, all those sort of things. So if you could just give us a bit of a sort of outline from your experience of running group therapy, how that would look to somebody joining a group.
Yeah. Well, the most important thing is that all of us, from our conception, if you like, are in a group. We're in our family group, we're in our work group, our school group, our society. We're always in a group. And the importance of group therapy is that it enables you to explore those interconnected dynamics with other people. And sometimes the first group, our earliest group, the family, can impact on us in different ways, and that takes us through our life, and we still relate to people as if they're our family, rather than a new relationship of group, as in work or society as a whole. So a small group therapy, which is usually about 8 people plus the therapist, myself, if you like, sort of represents the group as the family. So it tends to be able to explore those connections between siblings and parents or authority figures, but it also does enable you to think about wider networks in your work and how your family dynamics might impact on the way you perceive yourself in society or in your work setting. People come to group therapy because often they are struggling in relationships. And although one-to-one therapy is really helpful, there is something about being able to connect to a group and have the feedback from other people in the group that's not just about the therapist giving feedback, that's really important. And there's a kind of flattened hierarchy, if you like, in a group setting, where, if you like, siblings in the group can challenge the group therapist and say, oh, Vivian, I don't agree with you there. So you can work out how experience and being able to explore behavior and see how other people behave in a group it's almost like a laboratory for testing out how to do things differently when you go back out into your own world.
No, that really makes sense. So it's a completely a different way to sort of explore things, because you're doing it not just on a one-to-one with a therapist, you've got all those other kind of other people and their input as well. So presumably people have to be quite open to that, open to working with others if they join a group.
Well, they don't necessarily have to be open in the beginning, but I suppose be willing to set aside some of the anxiety about what it means to be in a group, because often people are anxious because their first experience of a group might have been not pleasant.
Yeah.
Their family experience or school, for example, bullying, something like that, may put them off being in a group. But if they can set that aside and if you like, trust me. I mean, they have to trust me as the therapist first and foremost, and the initial meeting is with me. So if they don't get on with me, that, you know, they're not going to get on with the group.
Yeah.
But once they're in the group, everybody's in the same boat. They're all anxious to varying degrees about being in the group. So in some ways, that means they're all in it together.
Yeah.
And so they want to support each other because they don't want to be hurt or made to feel unsafe as an individual. So they want to support other people. And I think, yes, there's no requirement for anyone to speak, but it's important over time that people get to speak about their issues, and then they can connect with other people in the group. And somebody might say, I recognize that, I resonate with that. And other members of the group would give them feedback either on their behavior or on the way they relate. And in the group, what tends to happen is people tend to show those parts of themselves that are both easy and complex, so that people can give guidance or ideas to change things. And so you can experiment with new ways of being in the group and then take those outside. Of course, there'll be issues, conflict comes up because you don't necessarily like everybody. But the thing about it is that you're not going to see those people outside, and it's confidential space, so you can work things through and be able to explore what it is that bothers you about a person, because it may be the same reason that someone outside bothers you, and you might learn how to relate to them differently.
Yeah, without the sort of repercussions that would happen in real life, possibly if they did that. Yeah. And how long do people, or how long do the groups tend to stay together? Do they have a finish point, or do people just join and leave and they're kind of fluid, or how does it work in a practical sense?
Well, most of the groups I run are what they call slow open groups, which means that people join and take the time they need. And, you know, there's a planned ending that somebody may say, I think I'm ready to leave, and they would then plan a leaving and say goodbye. And then at some point after that, a new person would join. So there's always between 5 and 8 people in the group at any one time. I recommend that people at least commit to 6 months before they decide the group isn't for them, because it takes about 6 months to settle with more people in, you know, than individual work. And the slow open groups can go on. So I've had a group running for 5 years in one NHS department, but it's actually still going 10 years later since I've left. So it continues and new people join. But I suppose on average, people stay in a group about 2 years in the main. And if somebody doesn't think it's going to work, they'll know pretty soon that when they join. And obviously most of my groups are online at the moment. And it's done via Zoom. And in terms of confidentiality, it's really important that people know that it's a safe and confidential space. And I work with people from all over the UK and sometimes abroad as well, that they join the group, and they join the group just with their first name on the video. If they forget, which is rare but does happen, they know that I can take their surname off. But everybody knows that it's a place for confidential sharing. And the more that people respect that, the safer the group becomes.
And I would imagine the fact that a lot of these groups are online now has sort of broadened the variety of people, like you say, people maybe from different ends of the country, very different sort of environments that they're from. And,
yes, I have people from India in groups. I've had somebody from Africa. So you've got a real diversity of population joining, which is great because it probably more represents how the world is now. And if it was just in a small community.
So it gives people a chance to sort of widen the kind of perspective a little bit as well by meeting people that they maybe wouldn't normally meet. Well, that's really interesting. Thank